As we start to see restrictions ease across the country, there is still concern over COVID-19 and a second wave. So here to talk about that this morning from the University of Phoenix, the College of Nursing Dean, Kathleen Winston. Thank you so much for joining us, Kathleen.
Thank you for having me.
So first, let's talk a little bit about the first round of reopenings, because we've already seen some retail. Next will be restaurants, and then by the middle of the month, likely everything else. So what do we need to be talking about and paying attention to with this first round of reopenings?
I think with the first round and then subsequently for following rounds, the most important thing is hearing again the things that we've been hearing so far. Continue to be vigilant. You don't have to be hyper vigilant, but continue to be vigilant in those good health practices. Continue to be aware of your social distancing. Whenever possible, you'll want to make sure that you're continuing with that 6 feet apart distance for individuals. Make sure you're maintaining those important personal hygiene practices that will make all the difference in reducing the spread of communicable diseases.
So some of it is going to come down to us, even though the statewide restriction might ease, we still, you're saying, should be maybe practicing some of that stuff on our own.
Absolutely. In fact, when this all first began, one of the messages that I really wanted to emphasize was the message of our personal responsibility in this, that the best way to limit and reduce the spread of any infection is by hand washing, and hand washing again. And only when hand washing is not available, then we might use hand sanitizer.
So let's look ahead. You talked about another wave potentially and another. So when we're looking at a second wave, what would that mean? What are the thoughts on that right now?
Right before some of this notification and experience of the coronavirus, we had a second wave of our seasonal flu. Last fall, we had the seasonal flu virus influenza A. And then in January, when we usually see a decline in seasonal flu, we started to see an uptick in that. And it was because we had the influenza B presented itself. So I think as we look at COVID-19, some version of that or some increase in that is a natural expectation. And again, how do we reduce and minimize the impact of it on us? We'll go right back to those personal practices.
I know one of the arguments that people have talked about is, well, the flu kills more people, but obviously coronavirus has killed people in a shorter amount of time. So we don't want to just brush off the possibility of a second wave. So what should we be looking for then? What would be signs that would indicate this is the second wave?
Well, I think, again, we're going to have better testing. So we're going to know about people who have built up some immunity. We're also going to have a little bit better diagnostic. We are already well prepared. So the experience that we've had to date was living a little bit more in the unknown because it was a new type of coronavirus. We worked from the coronaviruses as a group of viruses as part of the way to develop some additional knowledge about the COVID-19. And now we know a little bit more. So we take what we've learned and we use that information to help reduce the impact and maybe minimize the outcome of that second wave.
Would it be considered a second wave if we were to see a spike now, or are we talking about second waves mean a different season, say after the summer?
Sure. I think when you hear people commonly referring to the second wave, they're really talking about what are we going to be seeing in the fall, which is our typical flu season beginning, right? So how might COVID-19 be a part of that, or a version of the coronavirus be a part of that? Some spike that might happen that you'll hear the CDC talk a little bit about that comes with the reopening. That's a different conversation. The reopening is just simply we're getting back out into a more typical interaction with human beings. And again, I go back to whether we're talking about the reopening or whether we're talking about another episode of this virus. In all of those cases, our responsibility in personal hygiene, environmental hygiene, wiping things down, washing our hands, keeping social distance, and being intentional about where we go and when we go.
Dean Winston from the College of Nursing at the University of Phoenix, thank you so much for your time, your valuable insight, and I think the important reminders for all of us as we move forward.
Thank you.